Hello friends, my name is Dr. Vipul Mishra. I am a senior consultant physician and specialist in chest diseases and diabetes. I spend most of my time in treatment of respiratory diseases as well as diabetes. Um, Today I will be talking about one very important respiratory disease called bronchial asthma. Uh, the reason why I have chosen to talk about bronchial asthma is that there's been a lot of taboo and anguish on the parts of on the from the patients as well as from the doctors uh, in labeling a particular patient as asthma. Now this is all I think come from a word which we label as dama. Now dama is I think a big taboo word which has caused lots of anguish on the part of the patients, and most often dama is confused with lot of diseases which are actually different. So basically, from patient side, both the doctors as well as the patients use the term dama to address a lot gamut of diseases: chronic bronchitis, bronchial asthma, COPD. They are all clubbed into one disease called dama, and because of this, lot of confusion arises, and patients cannot understand their disease, and hence treatment of this patient suffers. Uh, First and foremost, I would like to stress the fact that bronchial asthma, which is which is an intermittent disease, and most of the patients of bronchial asthma are treatable. They can carry on with their life as normal as anybody else, provided they understand their disease well. And not only they, I think the doctors also should all need to understand their disease well and treat it in a uh, planned way. Uh, First, I would like to clear doubts about few of the terms that are confused with asthma. Now, asthma is basically an allergic disease in which there is congestion in your airways, and this which results in cough, breathlessness, and wheezing sound coming out of chest. But this can also come, these symptoms can also be displayed by another disease which is called COPD. So we need to first differentiate between these two diseases. On one bronchial asthma on one side and COPD or chronic obstructive airway disease on the other side. Symptoms many a times are similar. The treatment many of the times are common, but these two diseases need to be differentiated because the cause is different, the management most of the time is different, the course of the disease is different, and ultimate outcome is also different. Asthma on one hand is a disease which is strongly related to allergy. So basically it's in a strong allergic response of your respiratory system to allergens. COPD on the other hand is strongly related to smoking, and this is where the prime difference lies, because if you see COPD is a preventable and to some extent disease because it is caused by smoking. So a patient who is suffering from COPD, uh, if, if that patient can stop smoking, that would really be very beneficial to him. Hence, let's now concentrate on treatment of asthma. A lot of times, uh, patients as well as doctors uh, complain that most of the time, patients actually, that in spite of treatment, their asthma is not under control. They do keep getting symptoms. Uh, I think the reason why in some cases this would happen is because of uh, lack of communication, lack of awareness, and lack of education which a doctor should impart to his patient. The patient should be willing to accept and educate him or her about his disease. And once he understands the entire gamut of a disease, which is not actually difficult to understand, then I think that patient is a much better suited to controlling his disease and carrying out his or her normal life in a good way. Uh, One thing here again which I want to stress is that um, sometimes, a lot of times actually, the patients depend solely on their symptoms about their assessment of the disease. So assessment and monitoring of an asthmatic patient is very important, and this assessment and monitoring most of the time has to be done by the patient, because doctor is not available to the patient all the time. uh, I'll give you an example. uh, let's say this is a normal air tube of a patient, of a normal patient. Now what happens in asthma is there is an allergic response, there is swelling inside these tubes, congestion inside these tubes, and the size of the airway becomes this. Now you can very well understand, if a airway of a patient becomes like this, what are symptoms going to be? And that is why you have cough, you have breathing difficulty, because air cannot go into the lungs and cannot go into your body, and you have hear the wheezing sound. If you give some treatment to the patient and there is some response, patient gets immediate relief. Patient gets immediate relief. Within a few days he stops treatment. Now what happens is that patient has got 50% relief, but that disease process, that allergic process is still continuing inside. And that is why, unless the patient is treated to a point where he is completely free of symptoms as well as objective testing, complete control cannot be achieved. I'll give you an example. Let's see this very small and useful instrument called peak axillary flow rate. I personally stress a lot to my asthma patients that they should use very inexpensive and easy to use machine to monitor their symptoms. And the patient would find, basically what you have to do is to blow into a machine, and it gives you a reading. And by this reading, you can complement the reading that this machine gives with your symptoms, and you can tell the state of your asthma, which means that if you start having symptoms and if these readings start coming down, you know that you are probably heading for an attack. Or if you have gone to a doctor for your symptoms, doctor has given you some treatment, and at the end of 5-7 days you realize you are much better, your PFR can supplement your reading whether your disease is completely controlled or not. You might find that your symptoms are 80% better, but your PFR readings are not, which means that probably you need to continue your medications much longer. And that is why I stress, finally what I have to say is that if you have two patients with bronchial asthma, one completely controlled, leading a normal life, other one anguished about his disease, probably the reason why this difference is there. So self-education, I think, is the most important thing in treatment of patients with asthma. Thank you.